clinics are in crisis. That's according to the Ritshidze's community-led monitoring public data dashboard. That sounds like a mouthful. This dashboard attributes part of the crisis to supply of medicines and stockouts, human rights and the privacy of patients, long waiting times, staff attitudes and decaying and insufficient clinic infrastructure. Sibongile Tshabalala, the National Chairperson of the Treatment Action Campaign, that's the TAC, is joining us now to discuss this. Ms. Tshabalala, good afternoon. Welcome to the Midday View. Just reading that just reveals the extent of the crisis. I mean, how deep is it?
Actually, the crisis is so deep. I don't know. I don't think even the word crisis is still relevant to use in that. Actually,
is it a disaster? Is it a disaster?
Yes, it has collapsed. Actually, it has collapsed, and we are not sure how are we going to revive it or rebuild our healthcare system, because nothing is right in our healthcare system. As you were saying, talking about people who are accessing ARVs, most of the time those people have to be in the morning. You have to go to the facility in the morning and end up staying in the facility for more than 5 hours without accessing their ARVs. Like, for instance, the report that we launched yesterday, it shows that in Limpopo, people are waiting for about 6 hours in facilities to be serviced, and only 73% who are on treatment. And remember, we have 95 targets of UNAIDS, 95% of people knowing their status, 95% of people who are HIV positive who are supposed to be on treatment, 95% of those who are on ARVs that should be on the suppressed viral load. But by the look of things, we are far from reaching those targets. As much as we are talking about 73%, one might say, no, at least we are above the average, or we are nearer to 95, but we are still far. With these challenges that we are seeing on the ground, we are far from getting those.
Okay. From what I've seen, you are talking about the data that you're collecting under the Ritshidze project. 400, we're talking about 400 primary healthcare facilities that are responsible for delivering HIV services. And that's the dire picture you are painting there. Has it been worsened by the COVID-19 pandemic?
Yes. COVID, it has played a huge role, because as we are talking to you now, what we are seeing in every province, every government official, they are running away with issues of COVID. They are vaccinating people. They've deserted all the challenges that we've been having long ago. But as much as COVID also played a role, we were in this crisis way before COVID, because as civil society organization, we've been saying this, our healthcare system is in crisis and nobody listened to us. So COVID came and finished us up. So we are now in a disaster. We are collapsed because COVID, it has showed us flames. So the government couldn't keep up with the pressure of the COVID-19.
Now, one of the aims of the Ritshidze monitoring exercise you are doing is to really understand what is going on. And you are sharing this dashboard that you've developed with the media like us, and you also want policymakers to have access to it. What else are you doing besides creating this awareness by making the Ritshidze data public? What else are you going to be doing as Treatment Action Campaign?
We will continue to advocate for better healthcare services, to hold those in power accountable, but also not those who are in power. Remember, the facilities that we are monitoring are the ones that are supported by PEPFAR. So we are also holding the partners that we have in South Africa who are injecting money to South Africa to say they need to come up with a plan, or they need to continue support the work that we are doing on the ground to monitor how are the resources being used. Because the way PEPFAR is injecting money in South Africa, we shouldn't be in this situation. But also we are fighting corruption that is happening, and we want to show how much damage does corruption does in our healthcare system and on our people on the ground.
Thank you very much. Situation is not good indeed. That's Sibongile Tshabalala. She is the chairperson, national chairperson of the Treatment Action Campaign. Their data is across 400 primary healthcare facilities that are meant to be delivering HIV services. She says it's collapsed.